I'm Cliff Dupre. I'm with the Salute America team here at UT Health San Antonio. Welcome to the next webinar in our series, Let's Address Health Equity Together. Today's webinar is how to identify and equitably respond to local cancer needs. Our moderator is Dr. Amelie G. Ramirez. Dr. Ramirez is director of Salute America and its home base, the Institute for Health Promotion Research at UT Health San Antonio. She spent over 30 years directing research on communications to reduce chronic disease and cancer health disparities affecting the Latino population. She's also Associate Director of Cancer Outreach and Engagement at the NCI-designated Mays Cancer Center here at UT Health San Antonio. Dr. Ramirez.
Thank you very much, Cliff. And a special thank you to our panelists and all of you who've joined us this morning. We're really grateful for your participation. We're excited to discuss with you, how can we best respond to our local cancer needs? So this is becoming an important question, not only for our NCI designated cancer centers, but for our community as well. So, for example, for our Latino community, we now know that cancer has become the leading cause of death for them, and we don't really understand why. And we're having a larger Latino populations in many parts of the country. So we wanted to see how different cancer centers are responding to this need and how cancer is impacting our local communities. But we also want to hear from you. So please, send in your questions to us and feel free to direct them to a particular panelist if you'd like. But, we're here to truly have a dialogue together. We also want to know more about social determinants of health, those non-medical drivers or barriers of health that are contributing to the burden of cancer in our communities. And how can we engage our communities in solutions to reducing the incidence of cancer in our communities? So today we'll try to answer these and many other questions that might come through the chat. So we have a fantastic panel with us today. I'm going to introduce them in terms of the format for today. I'll introduce all our panelists, and then the last person I'll introduce will start off with a discussion, and then each panelist will have a few minutes to say a few remarks about their communities and what they're seeing in their communities, and then we'll follow with specific Q&A. So first this morning, I'd like to introduce Dr. Rebecca Jones. She's a faculty associate at UT Health San Antonio and is our Assistant Director for Community Outreach and Education at our NCI designated Cancer Center. Dr. Susan Vatter-Parampo is also the Associate Director of the Office of Community Outreach, Engagement, and Equity at the Moffitt Cancer Center in Tampa, Florida. And she's also been very involved, and we've worked together in the past years addressing cancer health disparities. And Dr. Phoebus Sampaio, also a two-time cancer survivor and patient advocate, recently retired as the Chief Officer of Diversity and Inclusion at the Share Cancer Support Program in New York. She joined the organization back in May 1996, where she used her knowledge of the New York City Latino community to develop programs for individuals who were predominantly Spanish speaking. And our first speaker represents our webinar sponsor from Genentech. It's a biotechnology company and a member of the Roche Group. We are pleased to have Veronica Sandoval, a principal in patient inclusion and health equity team with the Chief Diversity Office at Genentech. Veronica's policy and medical background, along with her personal and professional intersection of her Latino roots and her equity efforts, bring a rich perspective to Genentech's ongoing work in health equity and inclusive research. Veronica, I really want to thank you for being here with us today. And would you please share a little bit about what Genentech's efforts are with regards to health equity and inclusive research?
My gosh, thank you for that great introduction, Dr. Ramirez. And buenos días a todos. Good morning, everyone. Thank you for spending your morning with us. First, I would like to thank Dr. Amelie Ramirez and her team for hosting these webinars aimed at promoting health equity in South Texas and beyond, and particularly for the Latino community. As Dr. Ramirez mentioned, we at Genentech are very, honored and happy that we are part of this webinar series. At Genentech, it's a very sincere, and I'm very proud about this, that we approach everything that we do through a health equity lens. From the designing of our clinical studies to prioritizing access and policy initiatives, and even to our philanthropic investments in the communities that we serve. Recognizing that advancing health equity requires a collective effort and that we cannot do this alone. We need to have partners in industry, healthcare systems, advocacy, payers, policy, and everyone who touches the patient journey. So we are working collaboratively to co-create sustainable solutions and addressing those root causes of healthcare disparities, like Dr. Ramirez mentioned, those social drivers of health, to improve the education to care delivery for all of our patients. By partnering with local leaders and policy makers in communities that face disproportionate health inequities, at Genentech, we're proud to facilitate conversations and initiatives that are aimed at advancing health equity policy goals. These efforts include improving access to biomarker testing and increasing diverse representation in clinical studies. I am proud to share with everyone today that since 2022, we've been bringing together participants across the country in health equity symposiums like this one today that have touched over 11,000 participants across 23 states and 29 cities in the country, including, which I'm always so proud to say, 2 U.S. territories, the U.S. Virgin Islands and Puerto Rico. And this has been a total of 79 health equity symposia programs since 2022, and we want to keep growing this number this year. These programs have sparked community-engaged conversations addressing a range of topics, including mental health in the LGBTQ+ community, to what we're going to be discussing today, access and responding to those local care needs in our most underserved communities. Genentech is committed to investing in Latino health by actively supporting and spearheading local community programs. In one example, as a daughter of farm working immigrants in this country, I am so excited when I, was going and working with my teams to learn that Genentech is working with the Latino Farm Worker Outreach Program, aiming to understand those access barriers faced by the Latino farm worker communities in California and Oregon. And we're collaborating, again, very important, with regional organizations that provide that support to these farm working communities, but then also partnering with us to provide access with medicines to those farm working communities at no cost. Additionally, we funded local fiesta fairs in Pasadena, Texas, Chula Vista, California, joined forces with Univision in the Bronx, New York, and East Los Angeles in California to increase awareness about cancer and chronic disease risks in the Latino community. Because all of us know, and that is why we're here, how do we empower not only our patients, but our providers, our community leaders, to increase screenings, because prevention is the best way of keeping our communities healthy. I'd like to conclude with a quote from Leonel Rodriguez, a cancer survivor at the Mace Cancer Center. And he stated, "I trusted the doctor who told me here is a trial and it would be good for you. And I told him, yes, let's do it." Our aspiration is that every patient like Leonel will have equal access to healthcare and will be asked to participate in clinical studies. I'm looking forward to today's discussion on identifying and responding equitably to local cancer needs. Gracias por su atención. Thank you, everyone, for your attention. Back to you, Dr. Ramirez.
Mil gracias, Veronica. Very, very well said. Thank you. Thank you so much. Genentech has really been unique in its outreach efforts, and we are grateful that we have this opportunity to partner with Genentech and for all that you're doing to try to bring more equitable opportunities throughout the United States, and as you said, in the territories as well. So mil gracias. Thank you. Now I'd like to ask Susan from the Moffitt Cancer Center to please describe some of your cancer and cancer-related issues that are facing your community, and how your cancer is playing a role in helping, really address some of those needs in your region. So Susan?
Thank you so much, Dr. Ramirez, and thank you, Dr. Sandoval. I think you really teed up nicely what perhaps myself, Dr. Jones, and Ibis will be also describing, which is that importance of local context in really moving the needle when it comes to addressing disparities within the Hispanic community broadly. I always think globally, but act locally. And that is now a way that I think many NCI centers are addressing cancer disparities within their community. Next slide. I wanted to present a little bit of a process, not one that I invented, but Cliff, if you could go to the next slide. But one that really a lot of cancer centers follow, because disparities feel very big. And so how do we deploy the resources that are limited at our cancer center to make sure that we're attending to what the greatest needs are? So you may often hear people talk about a catchment area. Well, what is that? It's really what a cancer center defines as sort of the local geography in which they have reach. So for example, the Mays Cancer Center talks about South Texas as their catchment area. For us, it's West and Central Florida. It's these 23 counties that you see on the left. Once we sort of determine our catchment area, then we really do a deep dive into where are the vulnerable populations. That is, those folks that have historically experienced cancer disparities. And that can occur across a variety of dimensions, from race and ethnicity to age to other health conditions. And that helps us really understand where should we be focusing our efforts in terms of a population. We're very data-driven. So as you can see, we use a lot of information, tools, and technology. So for example, on the top right, you see a visual that shows where are the most uninsured Hispanic communities within our catchment area, so that we can then deploy our resources in a more targeted way to help address those particular needs. Next slide. Another, sort of way that we think about it is one size doesn't fit all for any community. And so once we've determined these priority populations, we're able to say, well, what does the cancer burden look like for those communities? And is it any different, or is it similar? And so you can see for our Hispanic community, the top 5 cancers, the top 6 cancers are pretty similar to the general population. But then we also do a deep dive where we see where are there specific cancers that may be present in higher rates in our Hispanic community. So for example, compared to the non-Hispanic white residents in our catchment area, Hispanics have a higher incidence and mortality for liver cancer. And so we know that when we're thinking about our outreach for the Hispanic community, we also need to be addressing that particular cancer. We also look at risk factors. What are things we could be doing today that we're not doing? One example is that 20% of women in Florida are not up to date with cervical cancer screening. That's something today. We don't need to invent anything to be able to do something about this particular issue. Next slide. Dr. Ramirez and Dr. Jones will probably either jump for joy or cringe, but many cancer centers use what's called a logic model. So it's really just a simple way of laying out, now that you've identified the problem, what are the steps you're going to take to address the issue? So if you could click one more time. In terms of context and priorities, our mission is to impact the communities that we serve. If you could click a couple more times just so everything comes through. I mentioned the priority populations. We heard from Dr. Sandoval about the importance of partnerships. That starts with a strong presence of advisors who regularly engage with the Cancer Center that represent the communities that we serve. We have a patient advisory board as well as a community advisory board. And then you can see logos of many of the organizations that they represent or that we work with. Without that, we're not going to be able to move forward. Next slide. So once we do that, then it's my job as the leader of our community outreach efforts at the Cancer Center to shape a team and a strategy that's really going to be able to help do something about this. So in terms of inputs, you know, as we appreciate in communities, people are our most valuable resources, and a team at Cancer Center is no different. So with our leadership team, we have strong, multidisciplinary, dedicated leadership with expertise that complements each other. And for our outreach team, as you can see, we try to think across a variety of dimensions, that they are multicultural, multilingual, multi-generational. But at the end of the day, the unifying theme for our team members in our outreach team are that they are driven and compassionate team members that reflect the community that we serve. Next slide. Then we think about, well, what are the practical things? How are we going to reach those communities? I showed you that map of how are we going to get to those communities that, you know, maybe need more access. So we do that in a variety of ways. We have materials that we distribute, digital outreach. We have a mobile unit. We have a podcast. So we think about whatever strategy makes sense for reaching communities based on their preference. Next slide. And so what do we do with all of those wonderful resources? I won't go through all of them, but it's a combination of what works for those communities. And that is really where our partners come in. They tell us what is going to resonate. Do we need to be in person? Do digital approaches work? Do some combination? If we don't meet the community where they are, then these activities aren't going to fly. And so, as Dr. Ramirez mentioned, there's always a focus on social determinants of health as well. So when we say, what does COE do? I would categorize it into sort of these buckets. There's the community outreach and education. We heard about the importance of clinical trials, that community engagement and research. Access today. I cannot overemphasize that enough. What are we doing in terms of community screening and linkage to care? We have community screenings, mobile screenings, a screening access program within our center, as well as navigation services. And then we make sure that it's not just our outreach team that's out in the community, but people at Moffitt broadly, our faculty, our staff, our team members. We are a very mission-driven organization, and I'm always pleasantly surprised by how many people just approach us to say, what can we do together? How can I be present in community? And we always say, we'll take it, because we have many things that you know, need that fuel, if you will, in terms of outputs. I'm very proud to say we just launched our first Spanish language podcast series. And here you see one of our first guests. So give it a listen. I'm happy to share the link as well. Next slide. And so taken together, if we're doing all of this right and logically and in a partnered way, meeting the needs of our diverse communities, we hope that we're improving learning and health beliefs that move people towards cancer prevention, early detection, trial participation, and that we're influencing our cancer center. I love that we have a leadership team that says, tell us what community needs, bring us that information. We hope we produce action and change. And, you know, I gave you some examples, and those go all the way from individual level behaviors to advocating for policy change so that more people can have access. And if we're doing that right, then we are improving conditions to reduce cancer burden on a regular basis. And because we are that bridge for our cancer center, we're bringing back our learnings so that we can tweak and refine, and we do it all over again. And that's really the beauty of having an outreach team at a cancer center that thinks along these lines. I think that is my final slide. Thank you.
Thank you, Susan. Gosh, that's a lot of work going on, and for small teams, right? We wish we had larger teams to do as much as we as much as we're being asked to do, but it's important, and engagement of the community throughout all of this is extremely valuable. So thank you for sharing that information with us. I'd like to now go to Dr. Rebecca Jones, and for her to share a little bit about what we through the community outreach and engagement team are doing at the Mays Cancer Center, and how what we learned from our community is guiding our efforts. So, Dr. Jones?
Sure. Well, good morning, everyone. So in terms of what we're doing here at the Cancer Center, I would say that our efforts align very similarly to those that Dr. Van Parampel just mentioned. I think across the country, we know that our designated cancer centers are asked that we talk to the community and that we bring that community voice and that community need back to those doing research and leading clinical care at our cancer centers. And so I will complement what you just heard earlier with talking a little bit more about the actual activities that our community outreach and engagement office does to engage the community. So when we think about, hearing from our community, one of the things that we launched about 1.5 years ago are listening sessions. And these are ongoing sessions that we make available to community organizations and communities that want us to hear what their cancer burden is and what they would like our researchers and our clinicians to know when they interact with the community. And so these listening sessions happen, usually on a monthly basis, if I'm honest with you. But one of the things that's really nice is when we develop these listening sessions, we didn't want the information to sit on a shelf. And so what we make sure we do at the end is we quickly summarize what we hear. We share it back with the community to make sure that we did get their messages correctly. And we actually share it with all of our researchers across the Mace Cancer Center, across the entire institution at the Health Science Center, as well as some of our affiliate universities like the University of Texas at San Antonio. With that information, we always make sure that the first thing individuals see when they read that summary is the ways that our researchers and our clinicians can engage with the community. So it's very clear and it's upfront to say, this is what the community needs, and this is what you as a researcher can do to take action to help that community. In addition to our design studios, we also have what we call our listening sessions. And these listening sessions provide a space where a researcher could come to our office and say, I have a research study that I'm starting or a clinical trial that I'm having trouble recruiting for. I'd really like to hear from the community. And so what our office does is we will work with that researcher to say, okay, well, tell us more about the population you're looking to reach. With that information, we will actually go to a registry of community experts, we call them, and we match what that researcher is looking for with the community group. And then we bring them all together virtually or in a room, and we have the researcher present their idea or talk about their research, their recruitment strategies. And the community has this open space and the safe space to share how that research can improve their study to be more culturally relevant and to be more appropriate for, actually addressing what it is that community might need. What I will say about our design studios is it's really grown more than I think our team thought it would, in the sense that we have a lot of community members who are very willing to share their voice when it comes to how research is being done. So I want to say that these design studios, it's something, we have a manual on how you can replicate this, and I think our office would be happy to share that. In addition to our listening sessions, one thing that our office actually just received was a PCORI Engagement Award. And this PCORI Engagement Award is going to allow us to actually develop a cancer health equity research agenda. But the nice thing about this agenda is that it is going to be driven by the voices of our patients and our caregivers. So our COE has done a lot with understanding what the community needs, and certainly patients and caregivers are part of our community. But we wanted to look a little bit more internally to what's happening within our cancer center and how we engage our patient population. So this research agenda is going to truly have our patients and our survivors lend their voice to what kind of research they would like to see, how our researchers should be engaging our patient population. And I think one of the things that we wanted to make sure we included in this research agenda was the idea that we focused on the cancers that are impacting our population the most. And so this research agenda is going to give a platform for researchers across South Texas and across the nation who want to engage patients and caregivers in liver cancer research, cervical cancer research, and pediatric leukemia. So those are just some of the ways that we intentionally reach out and engage and bring back to our cancer center what the community says they need.
Great. Thank you so much, Becky. And you know, what we're finding are those unique nuggets that our community has, right? Some ideas that perhaps our researchers hadn't even thought of. And that's why, you know, really having those opportunities to hear their thoughts and engage them in research. So it's one thing to have a concept as a researcher, but really, will it really work in the community? And that's where the dialogue between the two is really creating some very interesting work together. So thank you for sharing those thoughts. Now I'd like to move to Ivis. Ivis, you and I have worked together for a number of years, and I've just been amazed about, you know, how you have advocated for our Latino cancer survivors. Can you share with us how you use your Latino voice to influence and shape cancer care for others and to advocate for equitable research training and outreach in your communities? You know, you were in New York first, but now you're in Florida, and so you still nationally you do so much. So please share your thoughts with us.
Thank you, Emily. I appreciate it being invited to be with the special group. Next slide. Thank you. Okay. So basically, I just wanted to start, and I will go through these quickly. And yes, as we will be making these slides available to the community that's interested. And basically, you know, I am working as a patient consultant, advocate consultant for Albert Einstein and a group under the Disrupt Project. And I am not representing SHARE, but I did retire from them, and I did work for over 26 years, starting as their first Latina SHARE director, then became the senior director of programs, where I worked with both the African American, Latino, and the Asian community, as well as then retiring as their chief officer of diversity and inclusion. Next slide. I'm a 31-year breast cancer survivor thriver. I was diagnosed in 1993. I was misdiagnosed for 18 months. I had given birth to my youngest son, and finally got diagnosed at the age of 38 after advocating for myself for quite a while. And my kids were only 2 and 10 when I went through a series of chemotherapy, surgery, radiation, and hormone treatments. But in 1996, I found out about SHARE. And just prior to that, I did work with I volunteered and then worked with the Susan Komen Foundation for a year. And then I heard about the SHARE program, and I realized that's what I really wanted to do, work directly with the patients and giving them a voice. I grew their Spanish programs as the director from 2 to 12 support groups, and then from having one general educational program to 55 programs, all in Spanish, held within the support groups, because that's where I realized people were feeling more at home at these sites. So instead of having it in one general area, I listened to the community and changed it, and they became part of their support groups. We had also expanded our efforts both locally and nationally. And part of it was through just being there, having the voice there, making sure that I attended conferences, educational conferences, being asked to be part of committees, both locally and nationally, and always saying yes. Next slide. And yes, my family was exhausted by it. In 2009, I had this idea of a novela. And the idea came to me because I went to bed that night exasperated because I was hearing so many myths within our support groups and in the community of how they had breast cancer, why they had gotten it. They fell on their breast. If they had surgery, their husbands would leave them. So there was a lot of myths that were going on in that community. And I went to bed thinking, how can I educate them and help them? So I remembered that my mother taught me how to actually read Spanish. She was bilingual, using her novelas. And I was a comic book kid, so I sort of put the two together. And then what we did is we held focus groups with a variety of Latino communities, women who were born and raised in the United States and did speak Spanish, women who didn't, speak English at all, older women, younger women, women from Colombia, Puerto Rico, Mexico, the Dominican Republic. I wanted a variety of voices because we were going to be representing all those voices. And then we were able to design this educational tool in both Spanish and English to make sure that the English community that we were asking them to help us with the distribution of these novelas would understand what we were saying. Next. We also had the pleasure in 2011 of getting the first poster abstract for Share, and it was on the novela through the Latina Share program. It was very well received at the San Antonio Breast Cancer Symposium, and then since then we've had additional novelas. I worked on a metastatic novela for breast cancer, also an ovarian cancer novela, knowing that that was called The Silent Killer. In the meantime, women were feeling certain symptoms. So we wanted to be able to educate everyone as best as we could with information about clinical trials, about why you should be getting involved. And also the last one that I worked with my team was on genetics and breast cancer. And I know now that the group that is running the Latina Share program now is doing one on clinical trials, and I think on cervical cancer. So it's a way to educate the communities in both Spanish and English about information about these cancers, but also to be able to give them resources. And you can go onto the sharecancersupport.org website, and they have both Spanish and English to order these free materials. Next. In 2011, as I stated, I became the Senior Director of Programs, and I started to do a lot of community outreach. And one of the things that I did was listen to each of the communities, and I built community advisory boards where they would tell me what needed to get done. They would tell me what were the priorities. I've always had this issue where I want to make sure that you don't go into somebody's kitchen and tell them how to cook. You ask them, would you like to add this herb, or would you like to add this? But people can get offended when you go in and you say, I've got the answer. None of us have the answers. The community at large, they're the ones that are living and breathing that life, and we need to listen to them. So I worked with them, and within the African American, they wanted a lot of community outreach, and also with the Asian community with support and education. So as I mentioned, I became the Chief Officer of Diversity, and then I retired in 2022. Next. One of the things that I didn't mention was that there was a conference. We had a new ED come in, and she said she wanted to have a conference. And I said to her, you know, I'd love to do one on health disparities, but I don't want to have us present what are health disparities or the social determinants of health. The communities know that already. I want us to come up with ways that we can help them to make the changes, to determine from the community what are the changes that need to be made in order for us to provide the correct services and to help them. So one of the things I wanted to mention quickly is how you can get involved through patient advocacy. Some is through working with researchers. In 2012, Christy Graves from Georgetown asked me to participate, as well as other organizations, and we put together a PCORI-funded grant where we were trying to prove or find out whether or not support groups in Spanish for the survivors of breast cancer and their caregivers, would that work? And it certainly did. She listened to everything we had to say. We changed a lot of what was written, what was originally going to be determined from the study. She understood that we were in the community and we were representing the voices. And because of this, we were able to provide the support that was needed and to prove how important it is to support both the patient and their caregivers. And we, the leaders of the organizations that were involved, became co-PIs. We wound up becoming part of the journals so that, again, it's a teamwork. It's making sure that we're threads that come in together to build the fabric of what needs to get done. Next. Some of the work that we've also been able to do as advocates, I am part of the NCI Alliance on Clinical Trials in Oncology, and I'm able to represent the Latino voice. I've been a part of this for so many years. I'm very proud of it because now at this point, when a researcher is going to come and speak to us, basically first about the concept, the first thing they do is look at me and say, yes, we're going to make it available in Spanish. And I'm like, woohoo, this is exactly the voices that we need. And I said, next, let's do it in Japanese and Cantonese and other languages, because again, we want to be able to serve everyone. And when you work with the patient, with researchers as a patient advocate, we're able to give them our opinions, share our knowledge, come up with different ideas. Sometimes, as you mentioned, Amelie, the ideas that come from the community directly are the ones that really do work, because this is what the community is accustomed to. So they feel respected. They understand that we represent them. It's not just my voice. I always ask my colleagues, whether at SHARE and other organizations that I'm a part of, to ensure that when I am saying, I believe this is what needs to get done, it's not just my voice, it is the community's voice. And again, certain ideas, the novela, that's doing very, very well. And as a matter of fact, when we were at your conference recently, the new one came out and we were able to distribute it. And it was amazing, the feedback that we received. So again, it's working together. It's respecting that the answer is not going to be one team or the other. It's all of us together. Next. I just wanted to speak very quickly about the Disrupt trial that we have. It's being funded by Stand Up to Cancer, and it's in New York City. It's involved with Mount Sinai Hospital, Columbia University, Montefiore Einstein, and City College of New York. We have a variety of aims. Some of them are community members working with them, others directly with the providers and the patients, others directly with the researchers. We want to make an institutional change in every aspect. And I'm very proud of this, because what we've been able to do in the group that I am facilitating, this particular committee, it's the one where we're trying to reach out, do outreach and community educating the community. But the thing is that it's done with community leaders. They have gone, next slide, please. They have gone through our webinar, our website, original website. They've gone through and told us that's not the language you should be using. My community would not understand this. You need to add this. When we did the PowerPoint slides for presentations, their voices are being heard. We've trained them. They've taken citizen scientist trainings to make sure. This is so powerful. And this is, I think, what's most important is that the co-PIs listen to everything that the community members and the patient advocates are saying, and they're designing and redesigning everything that needs to get done so that we can accomplish these goals. Next slide. And again, as Latino patient advocates, we have the voices in 2 languages. I say 3 because I speak Spanglish, but the point of the matter is that we are the voice. You can hear what they need. You can understand how to design your clinical trials, because it's going to work in a specific community, as was stated before. You need to go in, you need to listen. And what I think is wonderful, and I experienced it once again over at your conference, Amelie, that the researchers are willing to listen, to understand that they're there to help us. And as patient advocates, we appreciate that wholeheartedly. But if the voices are not listened to, your clinical trials may not work. We need to be respectful of the community, get them empowered, get them involved, and then move it forward so that they can feel safe with respect to clinical trials, so that they can then participate. And the way we do this is working directly with patient advocates. When I was diagnosed 31 years ago, I was afraid that I would die. I spoke the language, I had the insurance, I had all the things to help me. And all I kept thinking is, if I feel this way, what about others that don't have insurance, that don't speak the language, that generation-wise, were not taught to speak up for themselves? What happens to them? Are they going to fall through the cracks? Are they going to die? And I made a promise to God that I would help every person that I possibly could in whatever way that I could. And I've been blessed that I've been able to continue even after I retired, even though my husband says you didn't really retire. But the point is, it's in my heart. It's what I want to do. And I'll always remember my mother, who always helped others in her building because she knew that it was important to help others. And she taught me that. And also she taught us that when we cut, we all bleed the same color. And that's what needs to be remembered. We all bleed red. We're all human beings, and we need to respect each other, help each other. And as you're climbing up, don't forget to pull those below you up onto your shoulders, because only then are we going to find the answers. Thank you.
Thank you so much, Evis. Oh my gosh,
This is
you
why I
said
do it. Those are the weddings that I was able to attend. My two sons getting married, and I'm now a nana, so I'm blessed.
Great. No, thank you so much, Evis. You've shared so much with us, and so much with your heart has been committed over the years to making sure that the voice is heard and that the voice is making a difference. And I think we all learned also so much about COVID. And this is, how if it weren't for the community, we wouldn't have been able to have the community response that we've had. And so working together truly makes a difference. So thank you for sharing those points. Now I'd like to kind of have just a brief discussion. There was one question that was already raised by our audience, and it's what can we think about in terms of other ways of improving cancer health disparities other than clinical trials? So I'd like to ask the panelists if somebody would like to respond to that question.
Go ahead.
Evis, I'm sorry. Susan, I'll let you, and then Evis, I'll go to you.
Okay.
Go ahead.
I'm really glad that somebody asked that question. It happened to be that the examples we gave were clinical trials, and maybe to put a word in front of it, therapeutic clinical trials, where we're testing one medication against another as an example to improve outcomes and hopefully reduce disparities. But one thing that some of us alluded to in our talks were that there's also a lot of disparities around things we know and can do today, where research is still highly beneficial. So I think about something like the HPV vaccine and how low uptake has been. So another opportunity is to conduct research studies about how to improve uptake or adoption of vaccination in communities that also have disparities in HPV-related cancers. And as you know, in the Latina community, cervical cancer is a disparity. So I'm glad that you raised that. The person who raised the question, because there's really a broad spectrum, and I bet your research studios kind of cover all those types of studies, and then really outreach today with the things we know today and removing some of those barriers in terms of access is why outreach teams kind of focus on all of these things at NCI centers. Evis?
Great. Hey, yes, Ivis.
I'd just like to add to that again, one of the things is when you speak to many of the community members, outreach and education is so important. So I think in many cases, what we're able to do, and we did that at SHARE, we've done this now to Disrupt, is we train volunteers and patient advocates to go out into the community to speak about why it's so important to learn about cervical cancer or the cervical cancer vaccine, why it's so important that you make sure if you feel anything in your breast that you go get checked and not let fear overtake you. There's webinars, there's podcasts, there's so many things that can get done in a variety of languages. And it just amazes me how much the community is willing to absorb. Because that's one of the other things that has come up with respect to clinical trials, that a lot of people will assume, well, it's from a community that doesn't trust, maybe they're not going to be interested. Don't assume, ask. That's what came back to us when we just simply asked, especially the African American community, they kept coming back to us saying, why aren't we being asked? Why was I not told, or my sister or my mother, about that clinical trial? Don't assume, be open, be sincere, and give them the opportunity and explain it in a way that they can understand it, so that then they can determine for themselves, is that what I want to do?
Yeah. And I think the other areas we need to do more behavioral trials, because we know that in the Latino population, for example, that they delay coming in. They delay, we know, for a number of reasons, but there's also that sometimes none of us want to face that it could be cancer, right? But if we can only get our communities to be screened earlier and to participate in screening earlier, we can do so much more. So I think we need to do a lot more work in behavior. And I think that's still an unknown area, right? That people think, oh, it's just take action, but taking action is hard because there's a lot of barriers. It could be a system barrier. It could be a lack of knowledge barrier. There's so many things that can interfere for individuals coming in. So
that's why, I'm sorry, but that's why we sent out into the community women who had gone through the process of either getting a diagnosis or going through a biopsy, and they're able to use their stories in a positive way, so people can connect that way.
Exactly. No, that's so important. I'd like
Dr.
to ask,
Ramirez, can I just add something?
Yes.
Because I think everything, that Ivis is saying and, is something that we have seen firsthand, and even working, through the Advancing Inclusive Research Site Alliance with you, Dr. Ramirez and Dr. Chalela, which is how do we empower our patients? Because that public health literacy is so important. And it's, Ivis, to your point, it's not just, having education brochures, but having that humanized way of explaining and encouraging and that preventative care, because we know our Latino community waits until the last, moment. And then they're like, please help me. And you're like, it is sometimes too late to help. So how do we change that mindset in the community? But even something else that you said, Ivis, that I would love to just, double click on, which is how it is more than, yes, it is our patients, but it's also our healthcare providers. Educating our healthcare providers on options, on what a clinical trial is. Because yes, Ivis, like our patients, our communities are not asked to participate. Like I ended with Lionel's quote, because he was asked, he participated, he trusted his doctor. Most of our communities do not have primary care physicians. Most of our communities do not have a trusted patient navigator or a promotora that can help them through that process. But if our doctors are also trained as to the benefits of all treatments, which includes a clinical study, I think our communities are going to be so much more receiving that equitable healthcare that all of us in this call and beyond and the listeners want to see.
Great. No, thank you so much, Veronica. That's so well said. And I'd like to ask Dr. Jones a question. Your unique study from PROCORI is to create a research agenda. Can you also talk a little bit more about that and how we're going to try to influence leadership in that area as well?
Sure. So when we create this research agenda, we're going to start by first understanding what it is that the community thinks about when they think of the word patient-centered outcomes research or comparative effectiveness research. I won't go into exactly what that means, but it's just this idea that when we talk with patients, we want to make sure that we are asking them about the questions they had when maybe they were diagnosed, or when they were asked, do you want to participate in a clinical trial? Or when they were asked, how are your side effects? How are your side effects of this medication? What are you feeling like after taking it? So first, it's just hearing from the patient. Once we do that, we're going to also talk with our clinicians and our researchers to understand what kind of infrastructure needs to be in place to actually have bi-directional, community-engaged research occurring within our cancer center. With that information, we'll then go ahead and do what we call a Delphi survey, which will allow us to actually prioritize the different areas of research that our patients and caregivers and researchers are interested in. And then that will all lead into the development of this research agenda. One of the things that I believe we were very grateful and beneficial here at the Cancer Center was having supportive leadership. And so when I went to our leadership and said, hey, we want to develop this research agenda, we asked them if there is a way to make sure that when we do institutional funded projects, that they're being focused on the priorities that our community identified in this research agenda. So it's more than just having a research agenda that says this is what we want to focus on. And it's more about making sure that there's actually buy-in from our cancer center to say, hey, we're going to prioritize research and fund research that the community said they're interested in. So I think sometimes it's difficult to get that leadership buy-in, but a lot of times it's just a matter of being persistent. And I would say that Dr. Ramirez and I, as leads of our Office of Community Outreach and Engagement, continue to tell our leadership and remind our researchers about the importance of working with our community and really doing what they would like for us to do when we can. So.
Great. No, thank you. Right. And it takes persuasion, we, as researchers, we have to come armed with data, and our data is coming from the community. So hopefully we can definitely create that change. Thank you. I'd like to go back to Veronica. Veronica, can you share with us how the healthcare and industry leaders partner with Latino expert organizations to address local cancer needs?
Yeah, no, thank you for the question. And I'm just like so amazed by all of the work that everyone has shared in this panel today. One, I mentioned, the Advancing Inclusive Reacher-Site Alliance. In that alliance, it's a very unique initiative that Genentech launched back in 2021. And actually, Dr. Ramirez is part of it. She's part of our Mace Cancer Center site. And, this is one, in, all of us, when we take a step back, and we're talking about clinical studies, we're talking about that community engagement and that trust, being that trustworthy partner to our communities. But how can you achieve that? And that's where we at Genentech became with the idea, if we were able to partner with sites across the country that were like-minded, could we find the secret sauce, right? So we can then share these best practices across all of our clinical studies, because, Genentech, like other industry, we have a diverse portfolio, not only in oncology, but in Alzheimer's, Parkinson's, multiple sclerosis, rare diseases, ophthalmology, and beyond. So with the idea of having this Advancing Inclusive Reacher-Site Alliance, and I'll take Mace Cancer Center as an example, because many of you are familiar with the Mace Cancer Center. And, Ivis, you mentioned this, right? We cannot do this alone in a vacuum. We cannot think about solutions as to how to better engage our communities without having those trusted partners. And that's what Mace Cancer Center has done for us. One of the things that we heard back from our oncology sites was we need more education for our patients. Our patients don't understand what a clinical trial is. And with the help of Dr. Ramirez and Dr. Chalela and others in the Site Alliance, we co-created animated videos, very, that are shown in terms that our patients can understand, but also not only in English, but have translations that are culturally sensitive, that, Ivis, I loved it, right? Because it's when we talk about Spanish and Latinos, we are not a homogeneous community, right? So having the thought partnership of patients, of, of physicians that understand who is the audience, that was so important for us. And as a matter of fact, these videos, we make them available free for anyone to use in our YouTube channels. They have been translated by Roche, our parent company, in 8 different languages. So, and they're all free, so if you want to have a video that was created with you and for you, the community, please, I would love to, send those, if anyone is interested, those sites. But that, having, and then most importantly, our healthcare providers. We heard from our sites as well. We need education for our healthcare providers. So what better way then to have our healthcare providers create educational materials that talks about unconscious bias and implicit bias, because that is so important when we're talking about breaking in these barriers that patients face. But most importantly, how do we arm our own physicians and healthcare systems to realize what is that systemic racism that exists and how can we start dismantling it? And how can all of us be part of a solution? So that is, as you can see, I get very excited about this because I think it's so important for us as an industry and as community partners and leaders to really come hand in hand and start creating more of these solutions.
Thank you so much. And you just, highlighted such an important work that in terms of, many people don't realize that they carry a bias. And so it's bringing to light that, let's check with ourselves if we are, and if we are, what can we do to change? Because that perhaps is not obviously not our intention, but it's an unknown, it's a background, right? And so all of these new materials are just really fascinating to bring that to light. So thank you so much. Well, we have just a few minutes left, and I'd like to go and ask each of you all a question as we get close to our wrap up here. So I'd like to go back to Susan. And Susan, what's working best to take community input and to guide your work there at Moffitt's with regards to research, training, and or education? And if you could just share with us in a few minutes.
Yeah, I would say what's working best is investing in consistent engagement with our advisory boards and our patients. And then something novel that we're trying is research partnerships with community organizations that serve our, areas. So there's sort of the individual advisor, but then as a community organization, for example, the YMCA in a local Latina neighborhood, as a research partner for some of our studies because they know and understand the community, what the needs are, reflect the population. So I think partnering kind of at that next level has been really working for us.
Super, thank you. Ivis, as a cancer survivor, what is the one thing you wish every cancer researcher would know?
I think first, that we really do appreciate the work that we're doing, and we understand that it takes a lot of time and energy. But I think also to remember that this is not a patient. This is Ivis, who had 2 young children, who was sick as a dog and still had to help raise her children. This could be Maria, who has a treatment that gives her a grade 3 diarrhea, and she's the only one that can take her kid to the school bus to drop them off. To take into account the quality of life, not just in the fact that the treatment, but specifically treatments that could hopefully be better so that then they can continue to extend our lives, but also to be able to have a better quality of life so you can enjoy whatever time you do have left.
And Dr. Jones, just real quickly, in 30 seconds, would you like to share a comment in terms of what are you finding unique at the Mays Cancer Center?
Oh, you're muted.
Of course I am. I'm sorry. I would say that there has been a shift in buy-in from our researchers to actually engage the community and want to find ways to engage the community. So I want to say over the last 5 years, just this continuous message of the importance of community engagement is really starting to take hold at our cancer center. So it's really inspiring right now.
Great, thank you. Well, first of all, I want to thank our audience and our panelists. Y'all have just done an amazing job. Thank you so much for being here with us this morning. Our hour has gone by quickly. We can't address the Latino cancer burden if we ignore the voice of the Latino community. So you heard different types of perspectives from our panelists today. And I'd like to thank you. I wanted to thank each of our panelists for their amazing work. And I just wanted to share the data with you that we also have something called a data visualization tool on our website through Salud America. It's called our Health Equity Report. So if you can go to salud.to/equity report, that will connect you to select your county name, and it will auto-generate a local report card. And that report card contains localized maps, data, gauges, and compares different health equity issues that might have been important, including healthcare access, housing, transportation, food, income, and much more. So please utilize that tool to help better describe what's going on in your community and share that with your community leaders. Again, that's salud.to/equity report. We will be adding this webinar to our on a video YouTube, so you can have access to it. And Cliff on our team will be sharing that with you. And we'll also add additional resources. If any of the panelists would like to add any resources that you'd like to share with our audience today, please do so. We want to thank our sponsor, Genentech, for enabling us to conduct this webinar series. And again, please check out our webinars at, again, salud.to/equity webinars. And thank you all for joining us today. And please send out other questions if you didn't have a chance to put them in the chat, and we'll try to answer them for you. Thank you all so much. We really appreciate it. All the best. Adios.
Thank you,
Gracias.
everybody. Bye-bye.
Bye-bye.